McDuffie, and I am a current PGY1 community care resident at The Ohio State University College of Pharmacy and the Charitable Pharmacy of Central Ohio. Today I will be presenting my poster entitled Assessment of Mental Health First Aid Interventions in an Underserved Community Pharmacy Setting. So as we get started with the background, according to NAMI, 1 in 5 individuals experiencing mental illness in a given year, with about 7% having at least one major depressive episode and 19% experiencing an anxiety disorder. It's also important to know that a previous study found that the percentage of individuals who receive treatment for their mental illness is lower in individuals who are uninsured compared to those with any type of health insurance. Also, perceived unmet needs for mental health treatment is on the rise for all and is 5 times higher for uninsured patients compared to those with private insurance. This background information is important for us to know as we move forward through the poster. So I'll go ahead and start talking about my location and practice model. The Charitable Pharmacy of Central Ohio is a nonprofit community pharmacy, and we are currently celebrating our 10-year anniversary. We service those Franklin County residents living at or below 200% of the federal poverty level, and all of our patients are uninsured, underinsured, or unable to afford their prescription copays. Our medication distribution process at Charitable Pharmacy is unique because each time a patient comes in for a new or refill prescription, medications, the patient has a private consultation with a pharmacist or pharmacy student. All of our encounters are documented in an electronic health record, and all diagnoses listed in the EHR are self-reported by the patient. So patients at Charitable Pharmacy have a variety of healthcare conditions, including mental health conditions. And in a previous study that was conducted at the pharmacy, it found that approximately 40% of our patients take at least one medication for a mental health care condition. When we look at those self-reported mental health diagnoses, 65% of our patients state that they have depression, 55% anxiety, about 22% with bipolar disorder, and 9% with schizophrenia. So, as we move on to the rationale of the study, with the incidence of mental health conditions at the Charitable Pharmacy being higher than the reported national average, the need to really evaluate patients with mental illness and their participation in mental health care services was an important area for us to focus on. It's also important for you to note that there are currently no studies that address the effectiveness of mental health first aid as an intervention. So my study really aims to fill this gap in literature by evaluating if mental health first aid interventions positively impact patients' behavior to seek out help after an intervention has occurred between the patient and their mental health first aid trained pharmacist or pharmacy student. The study objectives are there for your reference, and as we move on to the description of the program, Mental Health First Aid, it's important to note that this is a nationally recognized program that's an opportunity for anyone, including pharmacists, to really support patients with mental health conditions. It is an 8-hour training course, and it really educates individuals on the skills necessary to identify, understand, and respond to signs of mental health illnesses and substance use disorders. The training utilizes an ALGE action plan that it walks through in order to approach these patients, and based on this ALGE action plan, we at Charitable Pharmacy implemented our interventions that we have provided our patients. So this is a descriptive, prospective, structured verbal survey that was approved by the Ohio State University's IRB, and we included any patient 18 and older with a designation of MHFA between June 1 of 2019 and 12/31 of 2019. Patients were identified when they presented for their refills, and they were incentivized with a $10 gift card. So as we move along to the results, 5 individuals participated in the study before data collection was halted due to the COVID-19 pandemic. It's also important for you to note that many of the questions asked throughout the survey allowed for multiple responses. So 4 out of the 5 individuals stated that they were very likely to come back and discuss their mental health with their pharmacist. 3 out of the 5 stated that they were very likely to talk with someone in the future about their mental health. Of the total amount of responses related to the respective interventions, more individuals did state that they utilized their encouraged resources than those who did not. Barriers to accessing mental health resources varied, with the most common barrier being participants tried it before but they had a bad experience. So our first graph shows the commonly encouraged and utilized mental health resources that our patients were able to choose from. As you can see, all patients stated that they received a pamphlet with mental health resources, and all patients were instructed to take their medication as told by their pharmacist. When we look at the common barriers, 8 individuals stated that they did not utilize their resource. And of those 8 responses, 5 of the responses were that they tried it before, but they had a previous bad experience. So as we think about the conclusion and future directions of this project, it definitely supports those barriers to mental health derived from the current literature. Patients also may not seek help for their mental health because of previous experiences or a lack of understanding the need. Some of the limitations that I found from our research is my sample size, the individualized interventions. So some patients may have received certain interventions while others may not. Response bias, so all of these responses were self-reported by the patients, and then not utilizing a validated survey. As we look into the future, we will definitely continue to offer mental health first aid training to our pharmacy students and neighboring partners. Continuous quality improvement will need to be done in order to consider ways to better understand barriers and fine-tune resources. And lastly, we will continue to collaborate with our community partners to improve accessibility of resources for our patients. Thank you for visiting my poster, and if you have any questions or concerns, please feel free to reach out to me.